The government shutdown is shielding Republicans from one of the most catastrophic aspects of their big, beautiful bill.
I told you we have $17 trillion being invested, so the last person that wants to shut down is us. Now, with that being said, we can do things during the shutdown that are irreversible, that are bad for them and irreversible by them, like cutting vast numbers of people out, cutting things that they like, cutting programs that they like. And you all know Russell Vought. He's become very popular recently because he can trim the budget to a level that you couldn't do any other way. So they're taking a risk by having a shutdown because of the shutdown, we can do things medically and other ways, including benefits. We can cut large numbers of people out. We don't want to do that, but we don't want fraud, waste, and abuse.
How is that going to help? Your fellow Congresswoman, Republican Marjorie Taylor Greene, has a very different opinion than you on this, and she said that she's carving her own lane. She's disgusted that health insurance premiums will double if the tax credits expire this year, and she says not a single Republican leader in leadership has talked to us about this or given us a plan to help Americans with their health insurance premiums doubling. Is that true that no one in Republican leadership is having conversations about what to do about this?
We are focused on getting the government back open right now, and Chuck Schumer is the impediment to doing that. Chuck Schumer is the one who's making this keep people from working, the potential that some of these furloughed people can't get back to work. He's the one doing that. He's the one who's raising this issue. Open up the government. We'll be happy to debate and discuss health care.
But what is that? November 1st is open enrollment. So what does that look like?
This policy doesn't kick in. This change in policy doesn't expire until the end
December
of the calendar
31st.
year. Until the end of the calendar year. We got time to work with it. And we're happy to do that. We're happy to do that. But to me, the answer is not extending and expanding Obamacare, which again, everything we were told about Obamacare turned out not to be true. And the Democrats' position is we're going to extend it and expand it.
All right. Well, let me ask you about what's at the crux of this. Democrats are demanding the funding bill include an extension of the Obamacare tax credits, as we've been talking about. They're set to expire at the end of the year. More than 3/4 of the people who get health insurance through Obamacare actually live in states that President Trump won in 2024. We're talking about some 19 million people, Mr. Speaker. Can those people depend on congressional Republicans to extend those health insurance tax credits by the time they expire?
We have plenty of time to figure that out because, again, it doesn't expire until the end of the year.
Do you commit to that?
I commit to what Republicans have always done and what we've already proven this year in the One Big Beautiful Bill, the Working Families Tax Cuts. Republicans are the ones in Congress working to improve health care access, quality, and make it cheaper. We want to bring the cost down of health care. Premiums are too high, but it's not because of Republican policies. It's because Obamacare is not working. We're trying to fix it. We've just shown in the One Big Beautiful Bill, the Working Families Tax Cut, those reforms we made to Medicaid are not cuts to Medicaid. Medicaid will continue to grow. It's just growing at a slower pace. Why? Because we got illegal aliens and able-bodied young men without dependents off of Medicaid. They were never planned to be there in the first place. And what the Democrats are demanding right now to keep the government open is we put them all back on there. We're not doing that.
Mike Johnson, and to his credit, he does a ton of interviews, but everybody is pushing back on him about that, showing the actual text, which says we're talking about people who are lawfully here. And if you want to pull it out, go to the section that actually delineates.
Page 57.
Yeah,
I'll pass
Haley,
it over. That's the bill.
Oh, I've
from
seen
Chuck
it.
Schumer.
Yeah, no, I know. And if you go to the part below the one that's being highlighted on all the GOP accounts, you'll see that it's for people who are here, lawfully protected status, domestic violence survivors, et cetera.
That's what's being exploited. That's the whole point.
Yeah, when you're an asylum seeker,
that's the whole point.
Get free health care.
You do what you want. You want to make fun of us. You want to say
no. We just want you to acknowledge what you're identifying as legitimate isn't.
The thing is, you can mock Democratic messengers all that you want, but then that just says something terrible about the Republicans because we are lapping you when it comes to this. Washington Post, 17 percentage point advantage for the Republicans as who is responsible. Marist, New York Times, Siena, Morning Consult. Should we extend the ACA subsidies? The Kaiser Family Foundation, 78% say yes, including a majority of Republicans, including a majority of MAGA Republicans. Washington Post, 71% yes. The Wall Street Journal reporting today, inside the White House, aides are discussing proposals to extend the enhanced subsidies for the Affordable Care Act health insurance plans, officials said. Republicans know that they are being blamed for it, and rightly so. They're trying to kick the can down the road. They said, well, we'll deal with it the next time. But you have to make your plan choices in November, not in December when we're going to deal with this again. So go ahead, mock the live stream. Also, check out the GOP account on YouTube. The videos regularly get like 400 or 500 views. It's kind of reminding me of 2020 when everyone who would fan out in front of the cameras would say Donald Trump won, Joe Biden wasn't really elected, and then they get in a courtroom and their tail is between their legs and they're like, no, I don't think that. That's what happens. You're in the Oval Office, you act like a big boy, and you deal with Hakeem Jeffries and Chuck Schumer, but you get on TV and you say it's about illegals.
This is another example of President Trump deceiving and distracting the American people, Ollie. And as you pointed out, analysts across the political spectrum say there's no there there. At least you got a steak with Trump steaks. Now, this is much more like Trump University, where tens of millions of dollars were paid out because it didn't do what it promised to do. And consider that if you're on health insurance, which thanks to Obamacare, more than 90% of Americans are, you talked about that, you're already getting lower prices. If you sign up for one of those free programs, you're getting equal or lower prices. So it's pure marketing, but there's a danger. It's not just the deceit, the distraction. At the same time, this is why the government is shut down. Donald Trump and his allies are tearing away that Obamacare, tearing away that government health care from tens of millions of Americans, or making them pay more. And that is why Democrats will not vote to perpetuate that. So let's talk about the real health care crisis, not this phony.
That's exactly right.
Republicans have three choices. One is to work with Democrats on a bipartisan CR that ensures millions of Americans don't lose health insurance or see their premiums skyrocket. Two is for Republicans to do what Donald Trump said and pass the CR themselves. Republicans are in charge, after all. Or three, Republicans can shut down the government. And if they choose door number 2 or door number 3, make no mistake about what will happen. ACA tax credits will expire, and nearly 24 million people will see their premiums skyrocket by 93% on average. 93%. Now let me paint a picture. A mom and a dad in their early 60s, both have jobs. They make $80,000 a year combined. Right now, they can afford their health care, barely. But if these ACA credits expire, their bill jumps more than $17,000 a year. That's like a house mortgage. That's $1,400 a month, every month, just for the privilege of not going bankrupt if they get sick. Or take a family of 4 making $64,000. Their premiums rise by $2,600 a year. That's groceries. That's car payments. Now, it might not sound like a lot of money to my friends on the other side. Maybe the billionaires don't think $2,600 a year is a lot, but my constituents do, Mr. Speaker. And my guess is that millions of Americans will think that is a high cost to pay. Mr. Speaker, if these tax credits disappear, it is a 5-alarm fire. And Republicans are acting like they don't even smell the smoke. But should we be surprised? Of course not. The American people are already drowning in a cost of living crisis, one fueled by Donald Trump and the Republican economic policies. Their big, ugly bill didn't just raise costs for housing, groceries, and utilities. Its cruelest blow was to health care. They made the largest cut to Medicaid and the Affordable Care Act in American history, kicking millions of working people off their coverage. That means hospitals closing, nursing homes shuttering, preventative care denied. Oh, and by the way, families going hungry because food assistance was ripped away too. And while families are trying to stay afloat, while farmers are struggling with tariffs, while regular people suffer, Donald Trump decided to take an axe to medical research. He slashed the NIH, shut down cancer research, stopped clinical trials, torpedoed vaccine programs. I mean, what the hell is wrong with him? What is he thinking? But don't worry about health care. Don't worry about the ACA tax credits. We'll deal with this later. That's what the speaker said. Kick the can down the road. Well, guess what? We've reached the end of the road. Later is too late. The Congressional Budget Office says that if we don't act now and instead wait until December, an additional 1.5 million people will lose their coverage. That's a lot of people. That's a lot of people, I say to my colleagues. That's people in every single city and town in America. Premiums will climb even higher. Families will start getting cancellation notices in weeks. And open enrollment starts November 1st. So this is something we need to deal with now.
A recent poll conducted by the nonpartisan health research organization KFF found that more than 3 out of 4 Americans are in favor of Congress extending the enhanced ACA tax credits. 78% say that the credit should be extended beyond just 2025. And Republican pollsters Tony Fabrizio and Bob Ward surveyed 24 competitive congressional districts and found that support for the policy was high even for those with no personal connection to the health plans. There's no end game. Republicans are just relying on sabotage and blame to keep their base confused. But even the core MAGA base will know who to blame if and when they lose access to health care. The ACA is deeply flawed and absolutely no replacement for universal health care, but with ACA subsidies set to expire at the end of the year, people will die without that expansion.